Communication. Levels, elements, types, modes, process. Barriers, factors influencing communication. Introduction. The term communication is derived from Latin word communicare, which means to share or to impart. In simple words, communication is the reciprocal exchange of ideas, information, beliefs, feelings, and attitudes between people or among groups of people. Talking, listening, writing, reading, painting, dancing, storytelling are the various means to exchanging information.
Communication is the basic element of human interactions that allows people to establish, maintain, and improve contacts with others. The word communication originates from communis, a Greek word, meaning to make common. It is the transmission and receiving information, feelings and/or attitudes with the overall purpose of having understood producing a response.
Definition of communication. According to Webster's New Collegiate Dictionary, communication is a process by which information is exchanged between individuals through a common system of symbols, signs, or behavior. According to Millet, communication is shared understanding for a shared purpose. According to Peter G. Nordhaus, 1992, communication is the process of sharing information using a set of common rules.
According to Aristotle, communication is a means of persuasion to influence the other so that the desired effect is achieved. According to Paul Legans, communication is a process by which two or more people exchange ideas, facts, feelings or impressions in ways that each gains a common understanding of meaning, intent and use of a message.
Purposes of communication. To convey information. To obtain information. To influence others. To show emotions and feelings. Purposes of communication in nursing. To collect assessment data. To initiate intervention. To evaluate outcome of intervention. To initiate change which helps in promoting health. To take measures for preventing legal problems associated with nursing practice. To analyze factors affecting the health team. Levels of communication. Following are the 4 levels of communication. Level 1, conventional acquaintances. A person communicates with strangers to have casual acquaintances in the conventional level. E.g., first encounter between the nurse and the client. Conversation on this level is fairly impersonal. Here the attempts are made to be polite, to fill silence, to get acquainted, to relieve tension/stress, to convey incidental information. Level 2, exploratory associates. Here the conversation is fact and problem-oriented. Conversation is usually impersonal, e.g., relationship with colleagues, neighbors, etc. Relationship remains on this level for many years. Relationship is friendly but not open to very much self-disclosure, e.g., giving health teaching to public. Level 3, participate friends. Participate friends means people talk with themselves. Group is involved in self-disclosure. Here person expresses his own feelings, describes his own experiences and discusses his own ideas. Nurse, client can reach to this level only if they have developed good reputation. Level 4, intimacy. Closest friends at this level, people reveal themselves. They expose themselves intimately in a way that involves risk. Intimate relationships are characterized by communication of feelings and deeply felt mutual understanding, e.g., 2 close friends. Thus conventional acquaintances, exploratory associates, participate friends, and intimacy are the levels of verbal communication. Principles of communication. Communication should have objective and purpose. Should be appropriate to situation. Systematic analysis of the message, i.e., the idea, the thought to be communicated, so that one is clear about it. Selection and determination of appropriate language and medium of communication according to its purpose. Organizational climate, including appropriate timing and physical setting to convey the desired meaning of the communication. Consultation with others for planning of communication, involves special preparation. Message should convey something of value to the receiver in the light of his needs and interests. The communication action following a communication is important in effective communication, as this speaks more than his/her words. The sender has to understand the receiver's attitude and reaction by careful, alert, and proper listening to ensure that the desired meaning of the message has been comprehended by the receiver. Credibility is very important. Communication programs should make use of existing facilities to the great extent possible and should avoid challenging them unnecessarily. Factors influencing communication: perceptions, values, emotions, socio-cultural background, knowledge, role and relationships, environment, space and territoriality. Importance of communication in nursing. A critical component of nursing practice. Good communication. Generate trust between nurse and clients. Provides professional satisfaction. Is a means for bringing about change, i.e. nurse listens, speaks, and acts to negotiate changes that promotes clients' well-being. Is the foundation of the relationship between the nurse and other members of the health team. Helps to promote managerial efficiency. Provides basis for leadership action. Provides means of coordination. Elements/components of communication. Elements of communication are best explained by Berlow in his Model of Communication, SMCR.
Model.
S stands for source/sender. M stands for message. C stands for channel. R stands for receiver. Source. Source, also known as sender or encoder. The person who initiates conversation or sending message. LT suggests that source/sender must have an idea or reason for communication and must put the idea or feelings into a form that can be transmitted. Encoding includes choosing a sign or symbols to transmit the message, e.g. what words to be used, which language, how to arrange words, gestures, etc. Thus the source formulates message based on his/her communication skills, attitudes, knowledge, and socio-cultural system. E.g. in hospital setting, nurse as a source starts communicating with a newly admitted client while considering her communication skill, attitude, towards client, knowledge, health problems, and socio-cultural system of client. Message. The second element of communication is a message. Message consists of verbal or nonverbal expression of feelings intended to convey information to the receiver and requires interpretation by the persons. Encoding the message appropriately requires a clear understanding of the receiver's mental frame of reference. Knowledge of the desired objective of the communicated message is very important. Communication will be effective if the sender thinks thoroughly what the message is supposed to achieve and organizes the content of the message to focus on key ideas. Channel. The medium used to convey the message is the channel. The message having unique elements, structure, content, treatment, and codes are transmitted along channels. Channel can target any of receiver's senses, such as seeing, hearing, touching, smelling and tasting. Face-to-face interaction is more effective than telephonic or written message. Written message is appropriate for long explanations or for communication that needs to be preserved. Communicating recorded message through tape/television is effective for larger audience. Sometimes channel of touch is highly effective. E.g. client with hearing problem. Receiver. Receiver is the listener, observer who interprets messages based on her/his own communication skills, attitudes, knowledge, and socio-cultural system. Correct interpretation of the message depends upon the similarities in knowledge, experience, and socio-cultural background of sender and receiver. Limitation of this Berlow's model is that it has missed one important element of communication: response. Feedback. Feedback is the message that the receiver conveyed to source/sender. It is also known as response, which may be verbal or nonverbal. Example of verbal response and nonverbal response. Nurse to client: will you tell me your name? Client nodded his head: yes sister, my name is. Nodding the head means, Nonverbal response. Yes sister, my name is. Means, verbal response. Thus, feedback allows the sender to correct or reword a message. It also conveys to source that receiver has understood what source wanted to know.
Communication process. Communication is a process that is continuous and dynamic interaction between sender and receiver. 1. Sender. The person who intends to convey the message with the intention of passing information and ideas to others is known as sender or communicator. 2. Ideas message. This is the subject matter of the communication. This may be an opinion, attitude, feelings, views, orders, or suggestions. 3. Encoding. Since the subject matter of communication is theoretical and intangible, its further passing requires use of certain symbols such as words, actions or pictures, etc. Conversion of subject matter into these symbols is the process of encoding. 4. Communication channel. The person who is interested in communicating has to choose the channel for sending the required information, ideas, etc. This information is transmitted to the receiver through certain channels which may be either formal or informal. 5. Receiver. Receiver is the person who receives the message or for whom the message is meant for. It is the receiver who tries to understand the message in the best possible manner in achieving the desired objectives. 6. Decoding. The person who receives the message or symbol from the communicator tries to convert the same in such a way so that he may extract its meaning to his complete understanding. 7. Feedback. Feedback is the process of ensuring that the receiver has received the message and understood in the same sense as sender meant it.
Types of communication. Based upon relationship. Formal. Informal. Based upon flow. Downward. Upward. Horizontal. Based upon feedback. One way. Two way. Others. Visual. Telecommunication. Metacommunication. Based on relationship. Formal communication. It is the communication between officials on various positions in any organization or institution, e.g. between nursing superintendent and staff nurse. It occurs officially, e.g. in the hospital, company, college, school, etc. It occurs in formal way, i.e. formal language is used and it is done for the welfare of organization. It involves transmitting official message within or outside the organization. Line of authority and unity of command are maintained. It involves also communication between the departments. Informal communication. It is the communication between two people, maybe in social system or in organization. E.g. interaction between two close friends. It is very simple. This is very informal talk with the people. There is no formality in delivering the message among people. E.g. gossiping, backbiting, etc. Based upon flow. Upward communication. Communication occurs from bottom to the top. It may be in the form of suggestions, complaints, report, etc. It can be verbal or in written form. E.g. application for leave. Suggestions from staff nurses to NS for improving the quality care in hospital. Incidental report given by staff nurse regarding wrong medication. Written complaint by staff nurse to the director/president regarding the misbehavior of the NS/doctor. Downward communication. It is the communication which occurs from top to bottom, such as communication from superior to subordinate, e.g. from nursing superintendent to staff nurses. Downward communication is done to convey information, in the form of circular, instructions, policy, rule, and regulations, orders, transfer, promotion, etc., which are related to organizational activities and policies. E.g. information conveyed by President to nursing superintendent regarding hospital policies, promotion of employees, etc. Horizontal communication. The communication flows horizontally among same hierarchical levels. This kind of communication helps to improve the understanding among group, e.g., communication among colleagues, communication among lecturers, communication among staff nurses, communication among clinical instructors. Based upon feedback. One-way communication. It is the flow of communication from sender to receiver only. It always flows in one direction. There is no feedback, i.e. sender will not receive response from receiver and no participation of receiver. E.g., lecture delivered by teacher in classroom. Two-way communication. It is the flow of communication from sender to receiver and again from receiver to sender. There is participation of the receiver or learner/listener. It flows in two directions, i.e. forward and backward. Here the message passes from sender to receiver and from receiver to sender in the form of feedback. Example, group discussion. Receiver may add something or raise questions. It involves active learning. Others. Visual communication. In this communication, message is conveyed using symbols in the form of charts, maps, posters, painting, etc. Also known as symbolic communication. E.g., displayed models in exhibition, displayed posters on the wall. Telecommunication. It is the process of communicating in distant places with help of electromagnetic appliances, e.g. television, radio, internet, etc. Metacommunication. This communication occurs in deeper sense. It conveys message within a message. E.g., one lady is doing praise of her daughter-in-law. One friend is doing always praise of her friend. Here the actual feelings of mother and friend are need to be explored. In such communication, clients' verbal and nonverbal cues may not match. Modes of communication. Mode means the way by which communication occurs. The message can be sent verbally, talking, or nonverbally, gestures. Mode of communication. There are two modes of communication, i.e. verbal and nonverbal. These are described as follows. Verbal communication. It includes all the words the speaker speaks. Talking is most common activity. It is the primary tool of instruction while speaking. Source/sender communicate beliefs, values, perception, meaning, interest, and also understand it. The various aspects of verbal communication are followings. Vocabulary. For the effective communication, sender as well as receiver should have similarity in language, understanding. Because person belonging to different culture, ethnic group may find difficulty to understand and interpret the message. Pacing. Using pause at right time in order to make communication effective. Sender must speak slowly, clearly, and use pauses to stress particular point. Giving pause helps the listener to understand. If sender talks rapidly, using pauses awkward time, speaking very slowly, using slurred speech, can convey an unintended message. Even long pause, shifting to another topic may give wrong impression of telling lie. E.g., while giving health education on importance of balanced diet, nurse should give high weightage to the well-balanced diet and also use pauses at right time. Pace of speech indicates interest, anxiety, boredom, or fear. Denotative and connotative meaning. The denotative meaning is shared by individuals who use common language. E.g., Punjabi people using language Punjabi. Connotative meaning is the interpretation of words' meaning, influenced by the thoughts, feelings, or ideas people have about the word. Simplicity. For effective verbal communication, sender must use simple language, easily understood words, brevity and complete words. Language/message conveyed by nurse should be so simple that it could be interpreted easily by a layman. Thus nurse should avoid using medical terminology. For this, nurse need to learn the commonly used terms based on the age, knowledge, culture, and education of client. Example, instead of saying your leg will be cut, it can be stated as due to gangrene formation part of lower limb will be cut by keeping you unconscious. Clarity and brevity. Conveyed message should be very simple and clear, Short to minimize confusion. Sender uses words simple and direct to make communication effective. Brevity means using few necessary words for making message easily understood. Timing and relevance, if the message conveyed is in simple language, less time will be consumed for understanding it. Even the timing for interaction also matter. E.g., if client is undergoing for appendectomy in emergency situation, it is not appropriate time to collect information regarding his family, interest, etc. Relevancy of message is equally important. For example, discussing the complications of surgery is irrelevant for client admitted in medicine ward with typhoid fever. Message should be related to the person's interest and concerns. Adaptability, spoken message should be modified as per client's behavioral cues. This adjustment is known as adaptability. For example, nurse must know how to speak and express her gestures while interacting with an elated client or depressed client. As per client's behavior, nurse should alter her tone of speech and expression. For example, on the death of client in ward, nurse should express sad expression. Credibility. Credibility means worthiness of belief, trustworthiness, reliability. Nurse foster credibility by being consistent, dependable, and honest. For this, nurse must be knowledgeable as well as skillful and should provide accurate information to client. By doing so, she can gain trust of client. Humor. Humor is useful in case client finds loneliness in hospital/having painful situation. Humor helps in promoting a sense of well-being. Nonverbal communication. Nonverbal communication includes use of body language such as gestures, gait, use of touch, physical appearance. It helps in expression of feelings better than the spoken words. Observing and interpreting clients' nonverbal behavior efficiently is an essential skill for effective communication. For example, client with endotracheal intubation, on ventilator can't speak. He can express his feelings by writing on copy. Physical appearance, clothing, dressing, grooming, and hygiene provides information in social, financial status, culture, religion, group association, and even the self-concept. Change in client dressing sense gives a cue regarding his health status. Nurse can validate this by asking the client. Body language, posture and gait, action speaks more than words is a common well-known saga. Body movements, posture, gait of client depicts client's current mood, health status as well as about his self-concept. Erect posture, purposeful stride reveals a healthy well-being. Whereas slouched posture and a slow shuffling gait suggests depression or physical discomfort. Tense posture, rapid movements reflects anxiety. After observing body language, nurse verifies her interpretation by asking to client. Gesture, gestures means use of hands, body parts in explaining the things. Gestures are an invaluable way of communication for client with deafness, tracheostomy, intubated. Client may blink his eyes or move his eyes side by side to convey his yes or no response. Nodding the head, raising index finger, etc. are the gestures commonly used by such clients. A father awaiting information about her daughter's diagnostic test may wring his hands. Putting finger in mouth, pick at his nail, tap his foot or pace back and forth. Eye contact maintenance during interaction shows the confidence and willingness of client to listen. Lack of eye contact may reflect anxiety, discomfort in communication. Even eye movements reveals feelings and emotions. Wide eyes express frankness, terror. Raised upper eyelids reveals displeasure. Constant staring may be associated with hatred or coldness. Looking down on a person establishes authority while interacting at the same level indicates equality in relationship. Observable autonomic physiological responses, such as increased respiration, sweating, pupil dilatation, blushing. Paleness also reflects client's mental as well physical health status. Physical characteristics such as height, weight, physique, complexion, blueness of lip, nail reflects the lack of O2 in tissues. Weight and muscle tone reflects the weakness level. Paleness reflects anemia/anxiety level of client. Voice-related behavior, voice tone, happy good, pitch level, high pitch aggressiveness/hyperactivity, intensity of voice, high in pain, stuttering, in anxiety, pause, can't express, silence, not interesting, fluency reflects hyperactivity among client. Facial expression, frown, smile, grievances, yawn, pursed lip, tongue movement. Factors influencing communication process. Developmental stage/age of the client influence the communication. As per the developmental stage of life, needs of client vary. For example, a child can learn effectively through a story or by using dolls, games. Adolescent needs more explanations as he is curious. With age, body changes, such as vision problem, hearing problem, etc. Gender, one same message can be interpreted differently by the male and the females. Girls used to communicate for confirming message, establishing intimacy, whereas boys communicate to establish independence and status within a group. Values and perceptions. Values are the standards that influence behavior and perceptions are the mental image of an event. Every human being perceive and interpret message according to his personality trait, values, experience. It is very important for nurse to understand the client's values and perception. She can verify it from client to avoid creating barriers in the nurse-client relationship. For example, in hospital, nurse restricts the visitor's entry to avoid infection occurrence. But a burn patient may perceive it other way, i.e. because of defect in her physical appearance, her family members are not visiting her. Here understanding values and perceptions of client is very important. Personal space. Personal space is the distance maintained by persons in interaction with others. Professional nurse maintains good interpersonal relations and by observing client's health status, also maintains personal space. For example, when a client is emotionally very upset, or child is crying, she acts as mother, friend. For a normal client, she maintains a professional distance. Territoriality is a concept of the space and things that an individual considers as belonging to the self. For example, as client is admitted in hospital, he is getting bed, locker, chair, utensils, etc. Client consider all these things as his territories while taking anything from client. Nurse must sought permission from the client to remove or rearrange or to borrow. Roles and relationships. The role and relationship between sender and receiver affect significantly the communication process. A girl will interact differently with her father, teacher, friend, sister, nurse, strange person. Thus the content of message, choice, or words, sentence structure and tone of voice vary from role to role. Environment. A conducive and therapeutic environment is the necessity for the effective communication. So the environment should be noise-free, well ventilated and have temperature within normal range. Lack of privacy, light also affect the communication. Congruence is to what extent verbal and nonverbal expressions are similar or match to each other. Perception of congruence in communication is very important for effective communication. Because if nurse's verbal and nonverbal message does not match, client will lose trust and avoid interacting with the nurse. For example, while doing care of AIDS patient, if nurse is making disgusting expressions, client does not want to disclose his information with nurse. Interpersonal attitudes. Attitude reflects the beliefs, thoughts, and feelings about people and events. Attitudes such as caring, warmth, respect and acceptance facilitates communication. Thus nurse having such attitude will develop good interpersonal relations with client and colleagues. Whereas the lack of interest, coldness inhibits the communication and ultimately relationship.
Skills for effective communication.
Confidence. Confidence is very important for developing and maintaining a trust with others. Nurse will be confident if she has up-to-date knowledge, skillful and as well as having the self-concept. Critical thinker. Nurse must have this quality for the effective communication. She must collect the information, analyze it, and then interpret it. Nurse must think critically about the message she wants to communicate. Analytical means ability to examine the impact of message on listeners/recipients. For effective communication, nurse must be able to examine the verbal, nonverbal response of client. Open-mindedness, an open-minded communication will explore the information by entering in the situation. Active listener, active listening is the best quality of a good communicator. This can be done by nodding the head, maintaining eye contact, saying yes/no in between the conversation. Empathetic, empathy means perceiving the client's feelings. Being empathetic, enable the nurse to help the client. Simultaneously, client also develop trust on the nurse. Honest, honesty is very important in any of communication, whether it is formal, informal, interpersonal, or intrapersonal. Confidentiality, to keep the information secret and use it for the particular purpose, welfare of client. Confidentiality is important skill. Nurse must maintain confidentiality of client, psychiatry client, AIDS, HBS. She must maintain client's right of privacy and share the information professionally for providing best care and treatment. Knowledgeable, having a professional knowledge, is important skill in effective communication. Knowledge regarding what to ask and how to ask is also essential. Along with this, knowledge about the client's values, perception, beliefs, feelings, developmental age, culture, ethnic group is very important to initiate communication. Systematic, being systematic is important because good communicators tend to seek and provide information in an organized and focused way. Communication must be proceeded from simple to complex manner. Tactfulness is the pivotal quality for effective communication. How to convey message and get response is the essential quality of a good communicator. Barriers of communication. Physiological barriers. Difficulty in hearing. Difficulty in vision. Difficulty in expression. Difficulty in palpitation. When there is sensory deficit, auditory deficit, visual deficit, etc., message will not be conveyed or received. Psychological barriers. Emotional disturbances, crisis, anxiety, severe stress. Neurosis. Level of intelligence. Fear. Egocentricity, superior or inferior complex. Environmental barriers. Lack of ventilation. Lack of light. Extreme temperature. Extreme noise. Lack of privacy. Congestion. Socio-cultural barriers. Level of knowledge and understanding. Personality traits. Customs. Beliefs. Religion. Attitude. Linguistic barriers. Illiteracy. Foreign languages. Accents. Local dialects. Methods of overcoming barriers of communication. To overcome the physical barrier. Make appropriate sitting arrangement. Ensure auditability and visibility. Provide environmental comfort. Overcome linguistic barrier. Use simple language. Use audiovisual aids. Take feedback as frequently as possible. Explain the use of graphical symbols. To overcome psychological barriers. Provide assistance and show sympathy. Pay attention. Motivate the process. To overcome cultural barriers. Catch up with socio-cultural background. Explain the importance of information. Apply different method and resources. Importance of communication in health. Information. One of the significant purpose of communication is to inform others, i.e. convey message. In health system, primary function of communication is to provide information to public about prevention of diseases and promotion of health. E.g. through advertisement on television, newspaper, and poster, public is to make aware of protecting their children from polio. Education, LT is very important to educate the client regarding discharge planning, precautions to be taken, dietary management, and lifestyle modification. Education on these points is conveyed by direct conversation/communication with client, e.g. teaching mother to give breastfeed to newborn. Motivation. Motivation is the power which drives person to do from within/inside. Client can never recover from illness, until he is motivated internally. Motivation to modify lifestyle is given only through communication. E.g. 1. Motivating obese client to reduce body weight. 2. Motivating hypertensive client to modify dietary pattern and sedentary lifestyle. Persuasion. Persuasion means convincing, influencing the person. One of the important purpose of communication is to influence others. Communication helps the person to understand values, behavior of another individual. E.g. persuading the drug addict client to leave this habit and join the addiction center for this purpose. Counseling. Counseling brings change in the behavior of person. Therapeutic nurse. Client interaction helps him to better understand and deal with problem. Counseling provides support at time of crisis and helps in changing the behavior. E.g. counseling helps the client with suicidal thought to omit such thoughts from mind. Brings peace. Communication/interaction between two person helps in ventilating the feelings. Many times we want somebody should listen to our feelings. Once these feelings are shared or expressed, we get satisfied. Thus communication, either verbal or nonverbal, helps in mental catharsis and brings peace in mind. Reduces stress/tension. Ventilating the feelings through verbal and nonverbal modes of communication helps the client to get relief from stress. Health promotion. Above all mentioned functions of communication leads to promote the health. Importance of nonverbal communication in healthcare. Nonverbal communication fulfills several purposes of communication process, such as to express feelings, to regulate interaction, to validate verbal messages, to maintain self-image, to maintain relationship.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.